I'd like you to meet Dr. Rasha Aqel, Dr. Bayan Abu-Alrub, and Dr. Mahmoud Shhbair, three Palestinians who are part of the Islamic Relief Canada community through the Keys of Health Fellowship Program, a program that is addressing the shortage of adult subspecialty doctors in Palestine by bringing selected Palestinian physicians to do a fully funded fellowship program in a Canadian university. Each fellow will then return to Palestine with their new skills to provide clinical care and to enhance the healthcare system for millions. For this episode of Follow Your Donation, we met up with these three fellows, who are all in different stages of the fellowship, to learn more about the program from their point of view. The Gaza Strip is one of the most densely populated places on Earth, and since 2005, it has been under a land, sea, and air blockade imposed by Israel. Years of conflict and the blockade have left 80% of the population dependent on humanitarian assistance to survive. The healthcare system is under a lot of pressure due to staff shortages, lack of medical supplies, pressing health needs, and ongoing conflict. Islamic Relief Canada is working with Canadian doctors Dr. Tarek Loubani, Dr. Thomson and Dr. Rand Askaland to help address the issue of staff shortages, specifically adult subspecialty doctors. We met up with Dr. Thomson, who was very influential in getting this program off the ground.
The program that we've developed initially started with pediatric subspecialties. It was very clear from that work that even though that program was doing amazing work, it needed to grow, and it needed to also include adult subspecialties. Traditionally, when a patient turns 18 years of age, very artificially they are labeled as an adult, and so that means that they transition their care from the pediatric to the adult setting. And so in a high-income country like Canada, that transition usually is very simple, but in a place like West Bank, where you have 3 million people, and you have a fraction of the number of subspecialists. In some subspecialties, there's no subspecialists. Making that transition can be very difficult and sometimes doesn't happen at all. And that's one of the gaps that this program fills. We are able to facilitate that transition so that they can get the care that they need when they become an adult. Just to give you an example, in Toronto, a city that is similar to the size of the West Bank, there's about 60 endocrinologists or 60 diabetes specialists. In the West Bank, there's 3.
One of the doctors that will be filling this specific endocrinologist gap is Dr. Bayan Abu-Alrub. She is currently midway through her fellowship in endocrinology at Western University.
I did my residency program in East Jerusalem, Al-Maqasid Hospital. So daily we saw patients from West Bank and Gaza, they spent around 1 day, 2 days to see a specialist. So yeah, it's really very hard to have all of these hardship to go away from city to city to see just one physician, yeah.
While Dr. Abu-Alrub is hoping to fill the need for endocrinology subspecialists in the West Bank, Dr. Shhbair is currently back in Palestine and applying what he learned during his time here in Canada. In 2016, he completed his fellowship at Sick Kids Hospital in pediatric oncology and now runs the pediatric oncology unit in Gaza.
There was no any pediatric hematology oncology doctors here. The situation maybe 8 years back or 7 years back was every child diagnosed with cancer has to leave Gaza Strip to receive treatment or do nuclear imaging or do flow cytometry or cytogenetic tests. But by now, the situation is different. Maybe 50% of these patients are now being treated here inside Gaza Strip and being followed up here. We are looking forward to be completely independent. Most of the protocols I'm using now, I brought them up with from Sick Kids. It really made a lot of difference for the medical care provision for the patients.
Dr. Shhbair went on to discuss how alongside the program helping patients, The fellows are also able to share their knowledge and practical skills with the medical schools within Palestine. We also met with Dr. Rasha Aqel, who did her internal medicine training initially in the Gaza Strip and worked at Al-Shifa Hospital, but really struggled to find high-quality infectious disease training. Since we filmed with her in Gaza, she has safely arrived in Canada with her family and has started her fellowship in infectious diseases at Western University.
Having opportunity to do training outside Gaza, especially we are reading how the hospital outside Gaza look like, how diagnosing capacity, the management, the staff, the professors, the laboratory. All this make me impress that I will finally have opportunity to practice medicine in a new advanced center like in Canada. It was really like a dream for me. When I get this offer the first time, really I was jumping at home.
So not only is this program helping to alleviate the suffering of Palestinian people, but it's also making dreams come true.
The Canadian health program, the Canadian universities, it's one of the best worldwide, right? So for me, like, it was really a dream to have this opportunity.
How are you going to enjoy the Canadian winters?
First of all, the barca, the shoes, the ice shoes. I'll try to survive.
Dealing with Canadian winters seems to be an easy feat as you learn more and more about the hardships they have had to overcome to be here, from missing their families back home to dealing with the ongoing occupation, violence, and blockade in all aspects of their lives.
The period where I grew up, there were a lot of changes. Like initially, there was the first intifada. There were a lot of troubles regarding the security, the safety. Even going to school was a little bit dangerous at that time.
I remember there was many of the doctors stopped working at the hospitals. There was shortage in the staff, no medication. There was usually emergency call for staff, for medication. Even there was strike for the hygienist. There was garbage accumulated in the hospitals. It was a busy situation when I was doing my training at the medical school.
Despite these challenges and sacrifices, these outstanding physicians continue to excel and work to rebuild the Palestinian healthcare system. And of course, this could not be done without the support of our Canadian donors.
علشان يستمر هذا البرنامج اللي بلش محتاجين دعم بشكل دائم، لأنه هذا البرنامج محتاجين إنه يكمل، مش بس إنه يخرج عدد محدود من الأطباء وبعد هيك يوقف. إحنا سنوياً بحاجة إنه يكون في عنا 3 أو 4 أخصائيين سواء من الانترنال ميديسين أو من البيدياتريك. فهذا البرنامج بحاجة لدعم علشان يستمر، لأنه إذا توقف الدعم عن هذا البرنامج هاي الفرصة رح توقف، وبالتالي كمية النجاحات اللي عم بنشوفها والدعم اللي عم بنشوفه سواء في الضفة أو في غزة من الأخصائيين اللي عم بيرجعوا بعد ما يخلصوا من هذا البرنامج رح تتوقف.
These physicians are returning to Palestine and transforming lives. Through their endeavors, they have given millions the gift of health, hope, and a future filled with possibilities. Together, we'll continue to build a stronger healthcare system for all Palestinians. We envision a world where no one will be left without the care they deserve. Jazakallah khair for supporting this program, and stay tuned for updates on the progress of our exceptional Palestinian doctors.